Okay, we're going to demonstrate the ankle tape that we did in class. This is primarily for the person that is at risk for suffering the lateral ankle sprain, so they're rolling their foot inwards, or someone that's returning play from an injury that we want to help protect and give some support. So first step is having your athlete in the proper position, which is a 90-degree angle with the foot and the lower leg. Second application will be your heel and lace pads, one over the front of the ankle, one over the back of the Achilles tendon. Once these are in place, then we're going to pre-wrap. We're going to cover the lower third of the leg all the way down to the ankle and foot, to about the midway of the foot, and cover back up. You can choose to start your pre-wrap wherever you like, just as long as you cover one full layer from the middle of the foot. Make sure there's no gaps in the heel, coming up the lower leg, ending about a third of the way up the lower leg. Next step is going to be starting with 2 anchors at the top. Going to overlap by half each time, half the width of the tape. So we've got 2 anchors at the top. Now we're going to do a figure 8 at the bottom. So we're going to start right over the central part of the ankle, right where that ankle bone would sit between the 2 bones on the lower leg. Angling towards yourself, going laterally first. So start there, come under the foot, up over exactly where I started, follow it around to the back, and there's our figure 8. Now from here, we're going to build that side-to-side support by doing stirrups that are going to pull the ankle outwards. So we're going to do 1 stirrup, starting kind of towards the back of the inside bump that we have here, going straight down, right under the heel, coming up the opposite side in the same location. Smooth that down. Then we're going to work our way down with anchors after each stirrup. So I'll overlap by half again. Then I'll do my next stirrup, overlapping the tape by about half the width. This one's directly right over that bone, coming under on the opposite side in the exact same area. Going to do another anchor, working my way down. And 1 more stirrup, so that's a total of 3 stirrups, medial to lateral, and about 3 anchor strips around the lower part of the ankle. So you have these 2 small gaps of pre-wrap, that's okay, because those are going to get covered up with our heel locks. So our first heel lock we're going to do is a half heel lock starting on the lateral side. I'll start just above that ankle bone that we can find and feel, angling towards myself. Follow the same path that your figure 8 did. You should lay right over that, come under the foot. I'm going to go through my window between the outside bone and the heel, and I'll come around and finish exactly where I started on the outside. I'll do the exact same thing, doing a medial heel lock. So I'll start on the medial side, just above that bone, same angle as before, coming right over the top, under the foot, through the window between the ankle bone and the heel, coming around and finishing where I started on the inside. So we've got 1 half heel lock each way. Now we're going to put that all together into 1 full heel lock. We'll start just like we did the first one, high on the outside, same angle, coming under the foot, back through that window, and instead of tearing the tape off here where I would have before, I'm going to continue it around towards the back. Start to angle towards yourself a little bit, because then you're going to come through the window on the inside between the ankle bone and the heel, come up over the top, and you'll finish on the opposite side that you started. You started over here, we're going to end over here. From there, you shouldn't have any big gaps of any sort of pre-wrap showing. Little wrinkles, okay, sometimes that happens. If there were any loose ends here, I could cover that up with a strip, but for the most part, we've got a good bottom. We just want to fill in the top with anchors, working our way from the lower portion, overlapping by about half each time, working my way up to the starting point, and you'll see that as I get higher up on the lower leg, since it's more of a cone, I have a little bit of an angle to these anchor strips, just like I did in the beginning. This little extra pre-wrap, we can make that go away, that's fine. But this should be what your finished product looks like. Very secure, minimal wrinkles, functional, should be comfortable for the person. Okay, next we're going to demonstrate the simple arch tape. So this is more addressing an issue with the foot, any sort of arch pain, the plantar fasciitis we talked about, or maybe even doing some sort of support to try and maybe alleviate any sort of shin splint symptoms. So we're going to deal with the middle third of the foot here. We want to support this nice arch we have on the inside of the foot. So we'll just do a layer of pre-wrap, kind of the middle third of the foot area. Should only take you probably 2 or 3 passes to get around. Now the next step, we're going to start with the 1.5 inch white tape. So not the elastic tape. We're going to start on the lateral aspect of the foot. We're going to come under and pull up on the arch, but we're going to tear the strip here. So we're not going to go circumferentially all the way around. It's just going to be from this starting edge, coming under, pulling up, and tearing here. I'm going to start from her toes, pull up, tear it off, and I'm going to slowly work my way back, overlapping each strip by about a half or a third of the width of the tape to build a layer of support, probably 3, sometimes maybe 4, what I will call arch strips with the white tape. So that gives us our base of support. So I've gone from the lateral side to the medial side. Built our base. Now we're going to go to the 2-inch stretchy tape. You're going to kind of start in the same area, top of the foot towards the toes. Now this part, I want to tell you to grasp the outside part of the foot here to kind of block that tape from getting too tight. You want to pull up on the arch with a little bit of tension, and then we'll relieve that tension as we come around the foot because we don't want to squeeze that arch and make it disappear. We want to support it only. So this is going to be loose. I'll grab the little edge of the foot to block it so I can pull this part a little bit tighter, and then we'll let this kind of relax coming around. And one more pass should probably suffice to get a little tension there, and let it come around and lay nice and loosely on top of the foot. If you have that loose end, sometimes it's helpful to throw a little strip of white tape on top so that when the person puts their sock on, it doesn't roll up that tape. This should be your finished product. Make sure they have full function in the toes, make them wiggle them, your toes, make sure they're comfortable, not cutting off any circulation. You could check that capillary refill if we needed to, but that should be what your simple arch tape looks like. Okay, now we're going to demonstrate the patellar tendon strap to alleviate the pain of that patellar tendonitis on the front of the knee that's very common with our athletes. So we'll get the athlete in proper position, standing with the leg loaded, and she's going to begin by wrapping the pre-wrap from above the kneecap, flat around the leg, about 6 times. No overlapping, you just want a good steady application over itself. It doesn't have to be super tight, but it shouldn't be falling off either. So that's good tension there. Once she's gone around 6 times, she'll tear that off. And then she's going to roll down from proximal to distal, so that's top to bottom, over the kneecap and come to rest about right in the mid-substance of that patellar tendon or just below the pain site. So a little up-close shot there. You see kneecap ends here, patellar tendons here to here. She's right exactly where we want it to be. Should be comfortable, should be level, shouldn't be too tight, not restricting any range of motion. Okay. Last demonstration we have here is for some sort of injury to the thigh with a muscle strain, whether it be on the front with the quadriceps or on the back with the hamstrings. So you want them standing, a little bit of a flexed knee so that muscle's loaded. You're going to use the 6-inch wide ace wrap, single length. We're going to determine where the injury site is, so say this is where she strained her muscle. We're going to cover with the wrap from a little bit below to a little bit above. Starting directly on the front of the thigh, have them hold that edge of that starting point. Direction doesn't matter, you can go lateral to medial or medial to lateral, doesn't matter. I just tend to go back first. I'm going to cross over that front point. Now I'm going to angle up a little bit. On my next pass, I'm going to angle down a little bit. You'll see I'll kind of get a little bit of an X path. And I'm just going to continue that until I run out of wrap. I'm going to wrap it relatively snug, but not so tight that it's going to impede function. And then hold that loose edge for you, wherever that may be. Take your 2 clips, put those around the edge at the end of the wrap. So that's stage 1. So we have a little bit of an X pattern on the front. We'll finish with taking some of the 2-inch stretch tape and going over that wrap with a little bit more tension at the bottom, a little bit looser at the top to prevent the wrap from sliding downwards. A little bit tighter here, and then as I go up, I'm making it a little bit looser. That should be good. You can secure that loose end, piece of white tape if you needed to, not required, and that should be enough to suffice for some sort of support for a quadricep strain or a hamstring strain.